Namaskar, I am Dr. Neel Bhatavadekar, a periodontist, a dental specialist practicing in koregaon, Pune. At the outset, I would like to thank IISER Pune for inviting me on this forum to answer 10 questions for 10 Punekars. We hope through this portal that some of the concerns and the evidence and the information that's available for patients is further clarified. In Clarus Dental Specialties in Koregaon Park, we have a team of specialists that look at different dental specialties, and we also happen to be the only clinic in Pune listed by the US Consulate. I think the common answer would be infection control. However, in our case, it actually has been interpretation of data. Our infection control measures for our clinic have been in place for several years now, and they have always been there, assuming that every patient is positive for something or the other. Interpretation of data has been a problem for most dentists worldwide because there's a lot of new information coming out, and there have been different advisories which have changed over time. So it has taken us a little time to assimilate all this information together to bring it to clinical practice. We were shut for the month of April and May, and we reopened sometime in June. My main concern when the clinic was opened was, do we have all the evidence-based protocols in place as per the latest technologies and what is accepted worldwide to help cater to our patients best? And in fact, we were pleasantly surprised that we were actually had been following these protocols almost for the last 5 years, even before Corona. We always also assume that there will be a patient who will come in, and you assume that patients in general are positive, and you assume that cross contamination protocols have to be dealt with. We also ensured that we had a set of instructions that we sent patients in advance to help streamline this process. About how did we deal with these concerns? I think the first thing we implemented was that we implemented a protocol where we did a lot of screening on the phone. We had a set of instructions that the patients would get in advance that they needed to follow. One such protocol was to ensure that the patients came in to our clinic but waited downstairs in the car, gave us a call before coming up to make sure that no patient ever meets another patient. In between every patient, we always have a protocol for cleaning the clinic, right from the door handles up to things that are used. And we also keep enough time, between 30 minutes to 45 minutes, for aerosols to settle down so that there is the least risk of cross contamination. We've already had things like HEPA filters, air purifiers, AC filters in our clinic for a long, long time. But we just ensured that every single time that this was used, that things were on top of our game. We also wanted to ensure that we did things that were accepted from a worldwide standard, and we did address issues that had been brought up by the American Dental Association, for example, with dentists in the US, and similarly with dentists in Europe. And we assimilated all this information together so that we could cater to our patients in the best possible way. Interestingly, what we found in our practice is that once we opened, we actually had a lot of patients who had pending work. Our clinic had been closed for almost 2.5 months. So there were patients whose needs were evident. They had either pain or other issues that needed to be dealt with. We also understand that patients understand that this is something, Corona is something that we all need to now learn how to live with. It's not going away anytime soon. And we all have protocols in place that make it a safe environment to get treatment. Also, understanding the fact that dental needs cannot be ignored because there's a strong association between dental issues and systemic issues, which means issues with the rest of the body. For example, there's a known relationship between periodontal disease, which is gum disease, and diabetes. So there are a lot of issues which are dealt with, and there are pathways that communicate between the mouth and the rest of the body. So, to sum it up, no, we actually have not seen a huge change in volume. In fact, in the beginning, we had to screen patients on the phone so that we were not overwhelmed and that the patient's safety was not compromised. But I think now things have been streamlined and things are working quite efficiently. Undoubtedly, it would have been infection control measures that are in place or implemented at the clinic. Our patients have trusted us for several years with infection control measures that we have put in place. I don't think our measures have deviated tremendously for corona. One thing which has changed a lot, of course, is self protection, which means that the kind of gear we wear, the kind of gear that we ask the patients to wear. For example, when every patient who comes in gets screening done with a thermometer, with a pulse oxygen meter, they're given gloves, they're given masks to wear, head caps to wear. So there have been some changes in place, but I think it's been mainly mitigated with the fact that the patients are also well informed and well aware. Well, there are guidelines that have been put together by the Indian Dental Association, the American Dental Association, and dental associations of some other countries. But understand the fact that there is new information every day. Guidelines change. We try our best to adapt to the guidelines on a dynamic fashion, which means that as the guidelines adapt and evolve, we also evolve and adapt our measures to ensure safety for patients. But at the end of it, we have to be at the top of our game in terms of being updated. And every dentist needs to read up a lot more about corona than sticking to just the guidelines. You have to make informed and logical decisions that suit your own practice. And I think that's what's happening worldwide. Well, I wear a mask everywhere. In the clinic, I wear two masks. I wear a surgical mask underneath, and I wear a N95 mask on top of it. On top of that goes a screen which protects us from aerosols, and sometimes we have eyewear as well that protects our eyes. When I go out, I typically wear one mask, which I use a surgical mask, which is a three-ply mask. You could also wear a cotton mask, but there actually is a lot of evidence out there that shows that just simple single piece cotton masks are actually not that effective. It needs to be double at least. So, but yes, you should wear a mask wherever you go. The only place I don't wear a mask is my own house. So there has obviously been a lot of stress, not just amongst patients, but amongst dentists worldwide. Dentists fall in the highest category in terms of the risk group that is at risk of contacting corona because we are working at such close proximity with the patient's mouth. I think dentists have devised their own ways to deal with stress. Meditation is one, cooking is another. I think a lot of dentists have taken to cooking. Dentists that I know in general are quite skilled in art. So some of them have taken up painting, some of them have taken up photography. I think a lot of them are exploring hobbies and skills that they actually were there in them, but they never really had the time to explore them. So I think that has been a positive turn that has happened because of Corona. The answer to that is yes and no. We obviously limit who comes home. It is typically very close family. We have been meeting some people, but outdoors, and that too at a socially safe distance and with the wearing of masks. I think it also comes down to each person identifying whom they trust, who is also following the norms of safe contact. So I think as we evolve, as we go along, small bubbles will be created within each group of individuals, and probably people will stick to meeting people within that bubble. Well, I think my favorite thing to do has been to invest in time with my family, invest in fitness for myself. learn something new, try and cook new dishes, paint a little bit where possible, do a little photography. As regards Pune, I think we need to change our definition of normal if I have to answer that question. I don't think Pune is going to go back to what it ever used to be because everyone has changed. Everyone has gone through a fairly stressful time. I think people and the city has changed forever. There are some things that will go back to what we know Pune to be, but I don't think it's going to be anytime soon that the sense of normalcy that existed in February or January is going to come back. But I think I can see the dynamic spirit in the people of Pune, the fact that they want to move on with life, and I think that is something that we all need to cherish.